and chickenpox. And because this group are now about half of the deaths we have recorded this year, this is now an additional high-risk group that we need to think about so that we can, of course, reduce suffering and reduce the possibility of dying. From previous outbreaks, we had already identified that people who have any reason for suppressed immune systems were prone to more severe disease, hospitalization, and deaths. And of course, this includes organ transplant donor recipients, people receiving cancer treatments, or people with other secondary immunosuppressive conditions like HIV, AIDS, and the like. We are looking into getting tecovirimat as a therapeutic option, especially for these high-risk group people. And again, perhaps once we have managed to do that and demonstrated benefits, we can also look into expanded use in others from a perspective of, the treatment, if as effective as expected in our part of the world, will reduce the period of transmission risk and perhaps maybe help us bring the outbreak under control much more quicker than when we didn't have access to treatments. We have indeed made requests also for vaccines to WHO and the like. We know that vaccine doses are now scarce and far in between. Even the doses that have not been manufactured, talking about the third generation vaccine, are already all committed. But we hope that the World Health Organization can work out a framework that allows countries in some way to access the stockpiles that are managed on its behalf. We continue to conduct genomic sequencing, looking at the genetic makeup of the virus, and we know that that hasn't changed. We still have clade 2, which was formerly known as the West African clade. We're glad that we achieved the name change, but clade 2 is still the only type of monkeypox virus that we have. We haven't seen any importation of the clade 1, which was formerly known as the Congo Basin clade as well. Just moving on, and that's it for hopefully the 8 minutes. I'll be happy to take questions as may be required. Thank you.
I think you're muted. Okay.
Thanks so much, Dr. Adetifa. That was really very appreciative. And I'm passing it back to Dr. Kechi to take over. Dr. Kechi, you overspoke, so please, without me to hold everybody else accountable for time.
Okay, so tell me, this ends in 20 minutes or in 50 minutes? Okay,
I think they have 15, 20, 35.
Okay.
I want to make sure that there's time for questions.
Time for questions. Okay,
yeah.
So I'm going to turn it over to Dr. Prachi, who I'm sure would keep to time and not be like me.
You all see my screen?
Yes.
Sure, you see the screen without the notes? All right, well, good morning and good evening. Thank you so much for having me here today. I'm really excited to serve as a speaker at today's webinar. My name is Prachi Ranade, and I'm the Director of Epidemiology at the Peace Corps currently. I used to work at Inova Hospital, but I gave up that position about a little over a year ago. So I want to talk a little bit about a few things. Number one, the organism of the monkeypox virus, how it's transmitted, some signs and symptoms. Are there any treatments available? Importantly, what to look as a differential diagnosis, some infection control measures, what is the case updates in the US and globally, and I'm going to touch upon vaccinations. So the monkeypox virus is naturally occurring, and it's a relative of the smallpox variola virus. The word variola, or smallpox, comes from the Latin word varius, meaning stained, and varus, meaning mark on the skin. This virus, as people have mentioned, is endemic in Central and Western Africa. And clinically, monkeypox is indistinguishable from smallpox, except thankfully, it is much less severe. The virus was first identified and named when it was isolated by a laboratory in a laboratory of monkeys in 1958. And in Africa in the 1970s, it was first isolated in monkeys. The reservoir for monkeypox may be in an African squirrel, as seen in the picture here, but you can also see it in different rodents, rabbits, and primates are also susceptible to the infection. So the virus is transmitted through bites, aerosol particles in the skin, or direct contact with lesions or body fluids from infected animals or humans. Transmission via bed sheets and clothing has been reported and is possible. Of note, there was a person who claimed to have monkeypox from just going to a dance party where he danced with several people. So skin-to-skin contact in contact with people's clothing is all you really need to get monkeypox. And transmission can be from animal to person, animal to animal, or person to person. And as people have mentioned, it is you are able to get monkeypox through sexual contact, but in the nature, it is not a sexually transmitted disease, but you can get monkeypox through sexual contact, but also through non-sexual means. So some classic signs and symptoms. So on average, it takes about 12 days to develop symptoms after getting infected with monkeypox. And I'll go into why that's important once we talk about vaccinations. Initially, one develops flu-like symptoms consisting of fever and weakness. Then 5 days after a fever, a rash develops, and then you get development of enlarged lymph nodes. Someone can be infectious for 1 day before any symptoms begin, and for 21 days or until all the scabbed wounds have healed. The clade from West Africa is known to have a case fatality of 1 to 10%, and it's higher, the death rate is higher in young children and people with compromised immune systems, such as HIV, transplant, or people on chemotherapy. Like I mentioned, the monkeypox infection has two clinical presentations. The first consists of two clinical phases, excuse me. The first consists of 1 to 5 days of fever, headache, which can be intense, lymph node pain and swelling, back pain, myalgias, and fatigue. The second phase consists of a rash that begins 1 to 5 days after the fever. The rash is diverse and can look like anything from a pimple to a scab, or even it can be flat. The number of lesions and location on the body can vary. In the current outbreak, we're seeing lesions are frequently found in the genital lesion and in oral areas. And the reason for the genital lesions is probably the mode of transmission people are getting from sexual activity. The rash on the face can also involve the eye and lead to blindness. Symptoms usually last 2 to 4 weeks. Children, pregnant women, and immune-compromised individuals are higher risk for severe infection, especially children under the age of 8. So far, many of the cases in the US and Canada have been reported as mild, but this is not always the case. Complications can very easily occur, and complications can consist of sepsis, pneumonia, keratitis with the eye involvement, leading to possible blindness, and encephalitis. So what is the treatment? At this point, there is no specific treatment for monkeypox. There's an antiviral mentioned called tecovirimat, or TPOXX, which may be recommended for people who are likely to get severely ill from monkeypox. And these people, as I've mentioned many times, include weakened immune systems, people with HIV, people who have organ transplants on chemotherapy, but also young children below the age of 8. In the US, there was an outbreak in a daycare center. And those young children, many of them not only got the vaccine, but some of them also got the medication. So if you are infected with monkeypox and you're not in the high risk category, then it's really supportive care where you take care of the wounds and you take antipyretics. And this typically lasts around 2 to 4 weeks, the symptoms. So as I would say, just, consult with your healthcare provider and local health departments, because not only are there are no treatments, but also the availability of treatments varies greatly among countries. So as I mentioned, the differential diagnosis of monkeypox, it is not traditionally a sexually transmitted disease, but it has been known to spread sexually, and that's what we're noticing in the current outbreak. So it's important to think of other infections if you're looking at someone with a rash and are concerned about monkeypox. The rash can be similar to herpes. Also syphilis, it is common and reported that people with monkeypox can have more than one infection. So if someone is coming in with monkeypox, you also have to look at syphilis, chancroid, other pox viruses, and depending on where you are and what country you're in, LGV. There's also some evidence that monkeypox has been present outside of Africa for decades. It's difficult to isolate the virus, and symptoms can, because they can masquerade as other STDs, we think that maybe it has been present, but we just haven't known it for some time. As I mentioned, please remember it's important to get to think of other infections, because you can definitely get more than one infection in one patient. So some prevention and control, raising awareness of risk factors and educating people about preventative measures. In the US, the LGBTQ community has done a really good job with spreading the word of what are the risk factors in monkeypox, how to get vaccinated, and people have really adopted new measures on decreasing their exposure. So educating people about the differences between monkeypox and, it sounds like in Nigeria, chickenpox is very important to realize the differences, because they can look very, very identical. And once you are either infected or concerned, you should isolate from other individuals so as to not spread the infection. So some infection controlled measures, clean and disinfect the areas where people with monkeypox have spread time. It is possible to spread the lesions over clothing or bed sheets, so it's important to understand that. Soiled laundry should be gently and promptly cleaned in a laundry bag and never shaken or handled in a manner that may disperse infectious materials. And when handling dirty laundry from people with known or suspected monkeypox, you should wear full PPE, gown, gloves, eye protection, and a well-fitting mask. Right now in the US, many hospitals are putting people with monkeypox in airborne precautions, but at this point, it is not known to be classically aerosolized, but there is a small risk of this. So what's the situation globally? Right now, there are around 54,911 cases worldwide. And yesterday, there were 100 countries reporting monkeypox, but just overnight, there are now 102 countries reporting monkeypox. 54,400 cases have been seen in non-endemic regions, with 511 in endemic regions. There have been 15 deaths worldwide. So far, no deaths have been reported in the United States. So this is the breakdown of the cases in different regions. Right now, America is leading the way with the most number of cases as seen in blue, but it is followed closely by Europe as seen in the salmon color. So New York City has recorded a 7-day rolling average of 9 infections. That is a decline of 82% over the last 2 weeks. And why is this important? It's because New York City has the most number of infections of monkeypox in all of the US. So a drop of infections in New York